Hello everyone, my name is Dr. Olena Ioffe. I am specialist OB/GYN at Dr. Rami Hamed Center, and today we are going to discuss cervical cancer screening, and I will answer all your questions which you possibly have. Let's start.
Why is a pap test performed?
The pap test is performed to identify the abnormal cells which are covering the cervix. These abnormal cells, they are caused by long-term presence of the virus called human papillomavirus or HPV. The viruses live in the cells, inside the cells, and thus they are causing some damage. And this damage can be from minor to severe and even to cancer. And our job is, our task, to identify these abnormal cells at the earlier stage and to take measures to prevent cancer to grow. Even abnormal change should not turn into cancer.
How is the cervical cancer screening done?
Actually, the screening, as I told, the main goal of the screening to identify these abnormal cells. So we invite women on a regular basis to visit gynae doctor and to take some smear from the surface of the cervix. And it is called pap test. First of all, it should be done visual inspection during gynae exam, and then doctor will take some cells, smear, from the surface of the cervix. Just 2, 3, 5 rotation of this broom will collect some cells. These cells will be put into some liquid, and this box we will send to the laboratory where a pathologist will see under microscope abnormal cells. It is called pap test. And with the same procedure, we can identify also the presence of the virus and whether it is oncogenes or not oncogenes.
How does the cancer develop?
The changes are going from minor changes to severe and then to cancer. There are some structure of the cells. For example, normal cells has some features, size of the cells, cytoplasm, and nucleus. But during these changes, the structure of the cells changes to abnormal and finally to cancer.
When and how often the screening should be done?
Screening should be done for all women from 21 age till 65. After 65, only for special group of women, the doctor will tell you. But routinely from 21 till 65. From 21 till 26, they should do pap test every 3 years. Pap test only. Those from 26 till 65, they have 3 options. The first option, every 3 years, only pap test. Another option, every 5 years, pap test plus HPV testing. And the third option is every 5 years, only HPV testing. That's it.
Why no requirement for HPV testing for age group 21-26?
Those from 21 till 26, the majority of them, around 80% of the population, they have this human papillomavirus, which can go away within 1-2 years without any cell damage. And identification of the virus in this group will create only worries, unnecessary tension, but the management will be the same, just observation. So the program is for HPV testing is only from 26 till 65.
What to do if a woman has abnormal results?
As I told you, the changes can be from minor to severe and cancer. So the management depends on what kind of abnormalities will be found. If this is minor changes, the doctor will advise to just close monitoring. Maybe he will advise to come you after 1 year or 6 months to repeat pap test. Another option, maybe doctor will suggest in case of severe changes, either destruction of the cells with diathermy, cryotherapy, or even excision of the cells of the cervix with some special either knife, cold knife, or special electrical loop to remove the lower third of the cervix. And it is common misunderstanding and common worries when I'm calling to patient, inviting for further management for follow-up, and when I'm telling that you have some minor changes, they are usually, they worry a lot. And they're asking, doctor, I have cancer. Doctor, will I have cancer soon? No. It's just only minor changes which needs clarification and follow-up and further management. Nothing to worry, no need to worry.
What is a colposcopy?
Colposcopy is a special examining the cervix, visual inspection of the cervix with special magnifying device which shines the light onto the cervix, and we can identify any abnormal, maybe spottings or vessels. And common misunderstanding that colposcopy is a kind of surgery. This is nothing to do with surgery. It's just visual inspection under magnification, and this device enlarges the view 20-30 folds, so we are able to see the abnormal spottings and spots, and we can make biopsy from this abnormal area.
Why and when is colposcopy done?
The colposcopy should be done for 2 reasons. The first reason is when pap test is abnormal. The second reason is when the cervix looks abnormally or suspiciously. Common misunderstanding that colposcopy should be done only if pap test is abnormal. No, sometimes the pap test is normal, but cervix looks suspiciously. Doctor will see either some warts or readiness abnormal or abnormal vessels. In such case, also the colposcopy of must to be done.
How is the procedure performed?
The colposcopy, the procedure should be done and can be done at the gynae office. The procedure doesn't require any anesthesia. It's very simple procedure. It's painless procedure, and no need to worry when doctor invites you for colposcopy. It's just viewing, visual inspection with magnifying device.
What does it mean, a biopsy done during colposcopy?
When the doctor, during visual inspection under magnification, will find some abnormal places, areas, he will take some punch biopsy, taking some tissue from cervix to see precisely by pathologist what kind of cells there are. And many women, they are worried about biopsy. I just want to emphasize and to explain that lower third of the cervix doesn't have pain receptors. So normally it's painless procedure. Maybe some discomfort, but no pain. And after procedure, doctor will inform that probably you will have some spotting, or you will have some maybe discharge, or maybe low abdominal pain, minor low abdominal pain. It's absolutely painless procedure and with minor discomfort.
The recommendations from specialists.
And in the end, I just want to emphasize that a cervical cancer screening program and its implementation of this program into routine medical practice helped to reduce the number of cervical cancer cases significantly for the last 30 years. It's a great achievement of the humankind, and cervix is more lucky compared to ovaries. Ovaries, when we identify any ovarian cancer, it's already advanced stage. But cervix, we are able to identify the cervical cancer at the earliest stage and even pre-cancer changes. So I encourage you to take advantage of this achievement, to take care about yourself, and to visit gynecologists on regular basis, and to do cervical cancer screening also on regular basis.